Hello, everyone. I'm Alexia Cargonilla, and today my group will be presenting the cybersecurity governance and the risk management strategy for Medcore Health Network. Our report will be focusing on how the organization can strengthen its cybersecurity by implementing the ISO and the IEC 27001 as a foundation of its information security management system or ISMS. Organization overview. Before discussing the governance, it is important to understand Medcore's operating environment. Medcore is an Australian healthcare provider operating 3 hospitals and 12 community clinics, serving approximately 450,000 patients each year through a centralized electronic healthcare record system. Healthcare is one of the most targeted industries for cyber attacks because it stores highly sensitive patient informations and depends on interconnected digital systems. Organizations like Medcore also rely on legacy clinic system, third-party vendors, and busy healthcare professionals whose primary focus is delivering patient care rather than cybersecurity. A successful cyber attack can disrupt hospital operations, delay treatments, compromise patient privacy, and even affect patient safety. For Medcore, cybersecurity is therefore much more than protecting technology. It's about ensuring patients continues receiving safe and uninterrupted health care. Protecting patient information is essential because cyber incidents can directly affect patient safety and continuity of care. To address these challenges, Medcore chose ISO and IEC 27001 as a foundation of its cybersecurity strategy. The organization faced increasing ransom threats while also needing to comply with Australian legislation such as Privacy Act and notifiable data breaches schemes. Because Medcore also works with international vendors and research partners, it must consider international privacy requirements like HIPAA and the GDPR. Rather than managing each regulation separately, Medcore decided to implement one of the integrated information security management system based on ISO and IEC 27001. This provides a consistent framework that strengthens governance, improve risk management, support regulatory compliance, and protect patient information across the organization. Governance structure. Medcore has adopted three-line model to clearly define accountability for cybersecurity. At the top, the board of directors provides strategic oversight. The ensures cybersecurity remains organizational priority. The CEO or the chief of staff officer supports the framework by providing leadership, allocating resources, and promoting a strong security culture. The first line. The first line includes operational staff, clinical staff, department managers, and IT teams. These employees manage cybersecurity risks as part of their daily responsibilities by following security policies and protecting patient informations. The second line. The second line consists the chief of staff information security officer and the chief risk officer. They develop security policies, oversee compliance, monitor controls, and integrate cybersecurity organizations' enterprise risk management framework. And lastly, the third line. The third line is the audit and compliance director together with internal audit, who independently assess whether cybersecurity controls are working effectively and report directly to the board. The governance structure ensures the cybersecurity is treated as business and patient safety issue rather than simply an IT responsibility.
Hey guys, let's continue the presentation. So the next slides we got the roles. So the board provide strategic oversight and ensure cyber risks receive the same attention as financial or clinical risks. The CEO champion the information security management system, secure funding, and promote the culture where cybersecurity is everyone's responsibility as well. The CISO leads the implementation of ISMS and oversees technical security, and the chief risk officer ensures the cyber risks are assessed alongside clinical, financial, operational, and reputational risks. Finally, the audit and compliance director independently evaluates security control and reports findings directly to the board. Together, this role can create clear accountability across the organization. Moving on to the next slides, we got the So risk assessment. So Medcare follows the ISO slash ISE 27001 risk management process. This the organization first identify its asset and then assess the threats and vulnerabilities before determining the likelihood and impact of each risk. Unlike many industries, Medco doesn't only consider confidentiality and integrity and availability. It also evaluates how incident could affect the patient safety and continuity of the clinical care. The healthcare focused approach aligns with ISO 2799, ensuring that cybersecurity decisions always support safe healthcare delivery. So moving on to the next slides, we got the priority threats. Our report identified three major cybersecurity threats. That is, the first is ransomware, which remains the greatest threat to the healthcare organization. A successful ransomware attack can shut down electronic health record and delay the patient treatment. The second is third-party and supply chain risks. Medco depends on cloud providers, billing services, and diagnostic vendors. A security failure affecting one supplier can have this significant impact across the organization. The third is phishing or inside error. A single employee clicking malicious email or exposing login credential can allow attackers to move truly to the network and access sensitive patient information. This threat highly highlight why government staff awareness and technical control are equally important. So next slide we got the risk treatment is so once the risks have been identified, Medcore applies the appropriate security control based on the level of risks. Critical clinical system receive the strongest protection through network segmentation and endpoint detection and response, encrypted backup, and strict access control. Lower risk administrative systems are protected through monitoring policy and cyber insurance. The organization also performs various vulnerability assessment, access reviews, and annual enterprise risk assessment to ensure control remain effective. This layer approach allowed Medco to focus its resources where they have the greatest impact. So that's all for me, guys. Thank you.
Hi, I'm Lizita. Now I'm going to continue our presentation. And in this slide, I'm going to speak about implementation. Implementation is planned over an 18-month period. The project begins within a gap analysis against ISO IEC 27001 requirements, followed by a formal risk assessment. Next, Medico develops its information security management system, introduces staff training, and operates the framework to collect audit evidence. Internal audits are then conducted before an accredited certification body performs the final ISO IEC 27001 certification audit. Finally, continuous monitoring and improvement ensure the ISMS remain effective. In this slide, I'm going to speak about recommendations. Based on our analysis, we made 5 key recommendations. First, provide quarterly cybersecurity reporting to the board. Second, introduce mandatory cybersecurity awareness training for all staff. Third, strengthen third-party vendor risk management through contractual security requirements and continuous monitoring. Fourth, maintain continuous monitoring and regular risk review across the organization. And finally, align future ISO IEC 27001 certification with enterprise risk management to ensure cybersecurity remains an ongoing strategic priority. After that, in the conclusion, uh, cybersecurity governance is essential for protecting both patient information and healthcare services. By implementing ISO IEC 27001, Medico establishes a strong governance framework with clear accountability, effective risk management, and compliance with both Australian and international standards. Most importantly, this strategy demonstrates that cybersecurity is not simply an IT responsibility, it is a leadership responsibility that supports patient safety, organizational resilience, and public trust. So that's all about our presentation, and thank you.